Good morning. Today I'll be discussing on the topic health economics. Health economics is the study of the application of economic theory to health and healthcare. Economic evaluation may be defined as the comparative analysis of alternative course of action in terms of their cost and consequences. This definition was given by Drummond et al. In 1987. Economics analyzes how choices about scarce goods and services are structured and prioritized by individuals in order to maximize welfare. There is a growing awareness that healthcare resources are finite while the demand for healthcare is apparently infinite. Economic analysis provides a systematic framework for answering questions about the justification for using these finite and scarce health resources and helps identify solutions to some common problems in healthcare. We all use economics on a daily basis. For example, if we think, do I buy the cheaper dental chair or pay a bit more for the nicer one? By comparing the cost and benefit arising from the purchase of dental chairs, we are able to optimize our decision making. Using such economic techniques is the basis of health economics. Now, why do we need economic evaluation? There are many effective and worthwhile health interventions and programs to improve the health of a population. If we have a lot of money to be spent, then we can use it for all beneficial programs. But the reality, however, is we usually don't have that much money. For example, we have blood pressure medication, we have weight loss program, we have cancer screening program, and we have very limited amount of money for spending for all these programs. So if we spend all the limited amount of money we have for one intervention, then we don't have anything left for other interventions. Because of this, careful decisions have to be made to ensure that limited amount of available money is spent to achieve maximum benefit. So we have to think which is the most beneficial program and we can have it with this limited amount of money. Health economic evaluation is a tool that helps to take decisions. It helps us to compare two or more health interventions on the basis of their cost and outcome. Now let us think about the types of economic evaluation. There are four types of economic evaluation. One is cost minimization analysis. Second is cost effectiveness analysis. Third, cost benefit analysis. And fourth, cost utility analysis. MEBU, that is an easier way we can remember this. They all compare cost with outcome but in different ways. So before going to the types of economic evaluation, let us think what are the types of cost. There are three types of cost. One is direct cost, second indirect cost, and third intangible cost. Now direct costs are those which are directly associated with an intervention. The main focus of most economic evaluations is the direct cost. Examples are cost of medicine, equipment, X-ray machine, salaries of health workers, cost of transport, etc. Now, indirect costs are those associated with reduced productivity due to illness or its treatment. Example, missed wages due to illness. And the third type of cost is intangible cost. They are subjective and these costs are hard to put a value. For example, pain, suffering or grief due to illness or treatment. Now let us come to cost minimization analysis. Cost minimization analysis is restricted to situations in which the health benefits of healthcare treatments have been proven to be identical. It is used where product outcome is same and what varies is the cost. Few examples are, first one, decision to prescribe a generic drug instead of a brand name drug, achieving the same outcome at less cost. Second is blood pressure reducing medications by different manufacturers with different rates but having the same outcome. And the third is sealants placed by dental auxiliaries and by dentists which are equally effective. Now again in this picture you can see three different medications. The content is same but by different manufacturers and have different cost. So next type of analysis is the cost effectiveness analysis. This analysis implies either a desire to achieve a predetermined objective at least cost or a desire to maximize the benefit to the population of patients served from a limited amount of resource. This is the commonly used method in health economics. When you have intervention A, intervention B and intervention C, choose which is the most cost effective one. Consider two different interventions for weight loss. We are interested to know how many kilos we have lost. There are two programs. One is the diet program and the other is a medication program. So in diet program you will lose 2 kilograms for $300 and in medication you will lose 3 kilogram for $1,500. So now we have to see the cost effectiveness ratio. So for the diet program you will lose 1 kg for $150 and in medication program you will lose 1 kg for $500. So what do you understand from that? The diet program is more effective compared to medication based program. So the third type is cost benefit analysis. In cost benefit analysis, the benefit is measured as the associated economic benefit of an intervention and hence both the cost and benefit are expressed in terms of money. Cost benefit analysis consider all cost and benefit including direct, indirect and intangible to calculate the benefits. So comparison of the cost and health benefit may be accomplished in one of the two ways. First one, the net health benefit of a particular program may be calculated by subtracting the cost from the benefit. If the difference is positive, then the benefits outweigh the cost, and if the difference is negative, the cost outweigh the benefits. The second method is the ratio of the benefit to the cost may also be determined. If the ratio is greater than 1, the benefit exceeds the cost, and if the ratio is less than 1, the cost exceeds the benefit. In this example, you have solution A, solution B and solution C. The first row gives you the total cost and the second row gives you the total benefit. So when you see the cost benefit ratio, solution B has a higher ratio, which means the benefit is more than the cost. The fourth type is cost utility analysis. In cost utility analysis, health consequences are measured in units that estimate the quality of health outcome associated with a particular intervention. Most often, health outcomes are reported as QALY, that is quality adjusted life year, and the results are reported as cost per QALY. Cost utility analysis measures the final health consequences of a program rather than intermediate effects. So final health consequence, example, number of years with caries-free dentition or number of years gained because of early detection of cancer. And intermediate effect means, example, changes in caries incidence rate or cases of oral cancer. So when you have medication program, when you have screening programs, when you have kidney transplant programs, you have to see which has high QALY. So what is QALY? Health intervention try to prolong a person's life by increasing the number of years the person lives and also try to improve the quality of the years lived. So QALY takes into consideration these two aspects. QALY takes into account both the quality and quantity of life generated by healthcare intervention. In QALY, an year of perfect health is worth 1, an year of less than perfect health is worth less than 1, and death is considered to be equivalent to 0. However, some health states may be considered worse than death and have negative scores. So, QALY is calculated as the number of extra years gained as a result of the intervention into quality of life of those extra years. If an intervention leads a person to live for 5 years in perfect health, the quality of life is 1. So, QALY can be calculated as 5 years into 1, that is equal to 5. And if an intervention leads a person to live for 5 years but with a quality of life of 0.2, then QALY can be calculated as 5 years into 0.2, that is equal to 1. Using QALY, we can compare cost per QALY across different interventions. So, cost utility analysis compares cost of utility measures such as QALY for different interventions. Now, let us see what the types of study and the measurements of consequence. For cost minimization analysis, there is no measurement of consequences as the consequence or outcome are same for all the interventions. For cost utility analysis, outcomes are measured in natural units like life years gained, life years saved, etc. And for cost utility analysis, the utility of the intervention is measured. Usually QALY is used. There are other measures such as DALY, that is DALY. And the fourth one is cost benefit analysis. Here the consequences are measured in terms of monetary terms. Okay, so that is all about health economics. Thank you.